Hello everyone, my name is Vaidehi Matkar and I'm a rising junior at Vernon Hills High School in the suburbs of Chicago. I'm the vice president of our school's Future Medical Professionals Club and I'm also the president of our Girls Who Code chapter. I am also a research assistant at a health disparities lab working on a food as medicine adjacent study, analyzing the impacts of and improving a DASH diet intervention in the south side of Chicago. In the future, I hope to work as an internal medicine physician where I can holistically provide personalized healthcare to patients. But today, I will be discussing the impacts of structural inequities in food deserts, how these inequities contribute to global health disparities, and how we can leverage digital innovation to communicate and address these issues. According to the USDA, food security means access by all people at all times to have enough food for an active, healthy life. Unfortunately, many people around the world do not have this basic human right. But what are food deserts? Researchers use the term food desert to describe neighborhoods with limited geographic access to healthy and affordable foods. In the United States alone, around 13.5 million people have limited access to supermarkets or large grocery stores, while about 2.3 million people live more than a mile away from a grocery store and lack vehicle access. This lack of affordable transportation forces many individuals to rely on fast food and convenience stores, which often do not provide fresh or nutritious food. Combined with long work hours and limited time to cook, these barriers make it difficult for families to maintain a healthy diet. As you can see in this world map, food deserts are not just a local or national problem. They exist worldwide, contributing to malnutrition and increased rates of chronic conditions such as hypertension, cardiovascular diseases, and diabetes in their residents. Food insecurity limits dietary energy and micronutrient intake in children and parents, increasing risk of fatigue and depressive symptoms. For example, in Latin American low and middle income countries, 30% of households face moderate to severe household food insecurity, with developmental delay affecting a quarter of preschool children in these areas. All in all, individuals in these communities become trapped in a cycle of poverty and poor health, where health issues limit economic opportunities and economic hardship limits their ability to access healthy food. But these issues don't occur by accident. They are shaped by structural inequities that determine who has access to healthy food. Structural determinants of health are the societal and political factors that shape the conditions in which people live and work. These determinants include policies and systems that influence the distribution of resources and ultimately influence their health. One critical example is redlining. In the 1930s, the Homeowners Loan Corporation created maps grading neighborhoods for mortgage lending. Households with predominantly Black, immigrant, or low-income residents were outlined in red and deemed hazardous for investment, making it nearly impossible for residents to secure loans to purchase or maintain property. Homeownership is central to building generational wealth, and these discriminatory practices entrenched racial residential segregation and poverty across generations. This residential segregation has directly impacted food access. Negative stigmas around these communities discouraged new businesses from investing, reinforcing economic stagnation. Supermarkets, driven by market self-regulation, prioritize profit in low-risk environments. Food access became commodified, treated as a profit-based good rather than a right. So in order to truly address food insecurity in food deserts, while fully acknowledging historical structural inequities, it is imperative to get power back. In today's world, digital tools are our most powerful resources. They can transform food insecurity from a systemic barrier into an opportunity for individual empowerment. While meal delivery programs have tried to address food insecurity, many are not scalable or sustainable. Digital apps, in contrast, give the power back to individuals, allowing them to plan meals that fit their culture, their budget, and their preferences, all while learning to navigate and reshape their unique food environment. This is exactly what my app, Our Table, is designed to do. I developed a smart meal planning and food waste reduction app using Apple's Swift programming language that directly addresses the barriers present in food deserts and facilitates individual behavioral change. It allows users to input time and budget constraints and dietary restrictions to generate affordable, healthy meal plans that reflects their cultural preferences as well as their budget limitations. It provides budget-friendly grocery deals and seasonal produce suggestions to help users stretch limited resources. It allows users to input leftover ingredients and food scraps to maximize ingredient overlap and stretch their budgets. By providing practical, personalized guidance, this app helps users navigate their local food environment more effectively, make healthier choices within their constraints, and build skills to break the cycle of food insecurity. However, to truly scale the reach of digital apps and ensure they serve communities in need, policy change is essential. Policies can expand high speed internet and device access in underserved communities, integrate apps into SNAP, WIC, and Medicaid programs, support digital literacy programs, especially for senior citizens who face disproportionately higher rates of food insecurity, and finally, facilitate partnerships between digital tools, food pantries, and community organizations. With that, I encourage you to support digital literacy initiatives in underserved communities, advocate to your legislators for policies that improve food access, and invest in technology that can make a tangible difference in addressing food deserts. Because food insecurity is not inevitable, it is a systemic injustice that we have the tools to address if we choose to act. Together, we can dismantle the structural barriers that perpetuate food insecurities, empower communities with knowledge and choice to reclaim their nutrition, and build a future where every neighborhood has access to the nourishment it deserves. So let's not wait for change. Let's create it. One meal, one family, one community at a time. Here are my references. Thank you for listening.